Welcome, I'm Tom Caswell. I'm a market leader with Creative Mobile, and I'll be your host for the webinar, Increasing Patient Satisfaction with Mobile Websites. Leonardo da Vinci once said, "Simplification is the ultimate sophistication." And I really like that quote for healthcare, which with government regulation and the IT support that is needed for electronic health records, sometimes we overlook some of the simplest things we can do to impact patients. In today's webinar, we talk about mobile websites. Mobile websites will reach a broad audience for you and give information that they need to start the cycle of care. And part of that is just getting to your organization on time and parking in the right location and being safe when they enter your facility. And also just using the phone for one-touch calling if they have questions. So again, a simple solution that can be implemented quickly within your organization. For a mobile website does not need IT support, will not affect your budget, and can be installed within weeks, start to finish. So let's jump into the webinar. Mobile websites are part of mHealth, and mHealth is just mobile health, and as defined as the delivery, facilitation, and communication of health-related information on a mobile device. And there's a lot of different ways that you can go with mHealth, and your organization will certainly have a mobile strategy put in place. But in 2012, you can easily put together a mobile website strategy that will impact your patients in quick order. Any discussion of mHealth should include a discussion of mothers, a true power user of smartphones. In a recent study by Baby Center showed some fascinating information about mothers' habits with smartphones. They use their smartphone over 6 hours a day, and they do many things with that smartphone. Among the things that they do, which is very, very prevalent, is a third of all mothers actually look up health and wellness information within the last month in this study. And of those mothers, when they're looking up information, 60% are tracking health information, and a full 90% are tracking health conditions. This is a fascinating study because, as we all know, the mothers are going to move through the demographic groups and become more and more prevalent with smartphones. And when they go to your site with that smartphone, as this study shows, they're looking for health information. They're looking to track health of their family. And what does that mean? It may mean they're looking for a bill to pay the bill online on their phone. It may be that they're trying to schedule an appointment. If they can't do those things on your mobile website, then they're not going to have a good experience. And you're going to be missing out on giving a great experience for the patient. 2011 was an amazing year for smartphones, as the unit sales of smartphones actually exceeded the unit sales of PCs, laptops, and tablets combined. But for our discussion, let's talk about smartphone and tablets. They constitute about 64% of all unit sales last year. PCs and laptops are still strong. But the amazing part in 2012 is they looked at browsing history in 2012 January, and 20% of all browsing is being done on smartphone and tablets. And that's about divided evenly globally, about 10% for smartphones, 10% for tablets. So what does this mean for you? That means 1 in 5 patients that are coming to your website are on a mobile device, and 1 in 10 are on a smartphone. So we need to design specifically for that smartphone a website that they can access and they will gain value out of. And that's what this webinar is about, is talking about how we can specifically design for the smartphone and give the patients valuable information that will improve their experience. And how does that affect us? It affects us because if you don't have a mobile website that's optimized, it's a poor reflection on your organization. It's a poor reflection on how you are speaking to your patients. Because your patients are going to your website right now with mobile devices. And what do they see? In most cases, they're going to see a large website that's shrunk down to a phone. And some of us might say, well, that's okay. There's a lot of content there. They can zoom in, they can pinch, they can zoom out. But truly, An optimized mobile website designed for the phone will load 10 times faster than a non-optimized site. And what are they going to see when they get the large site that's shrunk down for the phone? Are they going to be able to truly get contact information and use one touch to tap that phone number and call the healthcare facility or the provider? Are they going to be able to get directions and use the GPS in the phone? Are they going to be able to search for a physician efficiently? The answer to all three of those is no. A large website shrunk down to a phone will have too much information, too much clutter, and not work effectively for your patient base. And that affects your patient satisfaction because it's affecting the patient experience of even trying to get to your facility, even just trying to call you. And that's what this webinar is all about, is talking about some simple, effective ways that you can reach a broad audience effectively with very little IT support, of no impact on your budget, and improve the patient satisfaction with a mobile website. There are so many great websites in healthcare today that are designed for the desktop. And these websites give a lot of information and have a lot of data that's specifically designed for the desktop and works fantastic for the desktop for the patient to find information. Unfortunately, when you try to take a large desktop website and shrink it down to the phone, it doesn't work. It loses context, and it doesn't work to find the critical information that the patients need. The patients may be looking for procedures, but more importantly, they're also looking for just simple contact information and location information that a large website shrunk down to the phone will be very difficult to find by zooming in and out, reloading the page. It's just not designed for the phone. So I wanted to take a moment here and just illustrate that optimized and designed for the phone is really the way to go for patient satisfaction, is designing specifically for the phone with the patient in mind and patient's actions in mind. Let's start digging into the design of a mobile website for healthcare. One of the first elements you want to consider is how can patients contact you. And there's a few different ways that we want to do that. We want to do a visual look at the phone so they can get information that they don't have to contact you anymore, and that could be business hours, office hours that you are open. The second part, very important, is you want to give directions to your office in multiple places. And we call that planned redundancy in the design. In those directions, the address would be hot linked, and if they elect to, they can hit one button and get door-to-door directions to your location. The next aspect is this is a phone, so we want to be able to give easy information, one-touch calling to your organization. As we segue into actual directions, one of the few powers of the phone, we can look at a few different ways that we can approach this. We can give a visual cue by showing the actual building that the patient is trying to get to, or the actual entrance that is associated with a department at a large healthcare organization or hospital. And everything on here should be hot linked and also should have a secondary view of a map view so people can find the location that's most convenient for them. So now we have the location. We want to hit one button, jump over to Google Maps, and get door-to-door directions to the facility. Simple, using the power of the phone, using the phone that they're comfortable with, that they're used to, and give them the directions right to your facility so they show up on time, they're prepared, and it reduces their anxiety. The web is certainly the primary source for searching for physicians now, and by default, as we showed earlier, mobile phones are being used to search for physicians as well on a very regular basis. So we want to address the searching for physicians on a phone and take it a step further and allow connections, increase the touch points with the phone so that once they find a physician, they can make an appointment with a physician or request an appointment with a physician. So let's show you how that works. So two different aspects here. You have two different physician groups. One has 5 physicians. One is many physicians. And you can search for physicians here, or you can just click on the physician that you are going to see. Once you find a physician, you're going to be able to get a great picture. You have a high-resolution screen on your phone. You'll be able to see the physician, see some phone numbers, information, see the credentials for the physician. But the next step to that process is, okay, we found the physician. We want to make a contact with the physician. And we want to use the power of the phone to make that happen. So we're going to actually allow for an appointment request or a callback. The appointment request could be there if you don't allow your schedule to be opened up to your patients, and they want to be able to just choose some times, narrow down the phone call connection that they're going to have with the office eventually, or to correspond back and forth with the office on when they would like to get an appointment. And the phone is a very powerful device that already has some tools built into it that will allow this process to move very smoothly. You can choose a day with a simple wheel function on your phone, and then you can choose a time. Very convenient, increases the touch points for your patients to either request a callback or make an appointment request and satisfy the needs and make a more satisfied patient at your practice or your healthcare organization. It's certainly challenging to put everything on a mobile site that you want to, that the patients want access to. But one simple way to do that is by using a tab menu style that allows you to use one-touch navigation for the patients to get to the critical information that they need. In this case, it's the specialty care services within an organization that patients want access to. So by using one-touch navigation, we're going to touch on the children's services, for instance, and that children's services will bring up the children's hospital and the specific directions, branding, and phone number information for this children's hospital. A nice, clean way to give specific information to the specialty care services within a larger organization. And it all stems from a logical design of a tab design that has a nice, clean font and a nice, easy way to do one-touch navigation to find the information you want. We've illustrated today many steps you can take to increase the touch points with a mobile website designed specifically for the phone. And in this case, we're offering a form to fill out in advance of their visit to your facility and get the registration process moving along quicker and smoother. Put the information on your phone, and what you want to do is take it the next step further, though, is you want to optimize the pages that are filled out on your phone to make it quick and easy for the patient or caregiver. And the next step is, on your end, to make the workflow easier at your facility. This form would actually reside on your website server. So if a phone accesses this form, the redirect code will recognize that it's a phone and serve up the information specifically in a phone format that's easy to read and the patient would appreciate. It's a great way to increase the convenience for the patient and, again, improve the patient experience. The last part of a mobile-specific website design for your organization could be, and I would urge you should be, giving ER wait time for the patients to see. For the ER wait time can be a very frustrating part for patients if they have to wait beyond what they expect when they arrive. So in this case, it's the average wait time, which is coded in, fed to this banner on the mobile website on a continuous basis and updated so that the patient can know how long they may have to wait at the emergency room. You can also use this space for emergency messages that can tell the general public that your hospital may be closed. Or you can use it for a career drive that you may have. There are various aspects that you can use this space, but it's a nice way to reach out to the community and offer a message to them while they're on their phone. Thank you for joining me today for the webinar, Increasing Patient Satisfaction with Mobile Websites. I hope you've enjoyed this presentation. If you have any questions, please feel free to give me a call or send me an email, and we'll start a conversation. Thanks, and have a great day.